are live right now, and on behalf of the Next, it's my pleasure to welcome all the participants to this next session, which will be about contactless healthcare. And I am joined by a wonderful panel. I have Sara, who is Canadian, and so she has the longest digital health touchless connection today. And she's Global Marketing Director at GSK. Then we have Felix. Felix, based in the UK, is the founder and also medical director of MedDigital. And I advise you to go and have a look at that website. And then Dan is head of customer engagement at Sanofi Genzyme. So they must also be extremely busy today. Thank you all for being here. Contactless healthcare. As you can see, my white hair, I'm an old fart. I spent my whole career in pharma since end of the 80s of the last century. And I come from an era of in-person healthcare. I'm a physician, and by oath and by law, the only way to practice medicine in my country and many other countries is to have a physical presence with an examination of the patient, right? To the point that even phone advice is not recognized or reimbursed, which was very frustrating to many physicians that were doing that. And it was the same for pharmacists. So we were really in-person healthcare. And that's not too long ago because I'm not that old. The first wall to tumble was pharmacy, where we started in the UK first to see online pharmacies, right? Lots of resistance everywhere, but today it's coming good. And we know there's a price to pay. We have about 15% counterfeited medicines being traded over the internet. But all in all, the system works. Now, medicine, we are very conservative people. So we resisted for a very long time, and then COVID happened. So with the panel, we'll explore what happens with that. So I'd like to starting with Sara, I'd like each of the panel to briefly say, what is contactless healthcare to you? And could you give one example of something you've seen happening since COVID? Sara, thank you.
Yeah, thanks. Thank you very much. I think what's fascinating to me around contactless healthcare is really looking at, to your point, how we do catch up to sort of the rest of the world in terms of just the internet. Frankly, you know, when you think about the fact that the internet has really been sort of widely used for, let's call it 20 or 25 years, we haven't really made use of that as a tool truly within our environment until we're sort of forced to. And to your point, we're sort of conservative that way. When pushed to use it, you know, there's a lot more use. But it is incredible what we're able to achieve right now through contactless and through remote. And frankly, I hope it's a trend that doesn't go away. But I'm just impressed at how much we can do. I mean, when we think about everything from our kids being able to learn remotely. So my daughter's actually been learning remotely for the past year. She's still at home right now. She's even doing gymnastics through Zoom and doing online courses. And so when you think about it, you know, we've done all of our, you know, physician appointments, all of our work, all of our schooling, all of our activities through Zoom. And so I think it has so far opened up just a world of possibilities where I think before we were thinking it couldn't be done. To me, what it's opened up in the past year is the possibility that there is so much that actually can be done. And through healthcare and contacting with our customers, we're finding that we're getting really great conversations, not just as teams internally, but with our customers externally as well, you know, even though it's through virtual means.
So thank you for making the connection and the comparison with education, because we're all confined at home and learning to be closer to our kids' education than we were when we were telling them, see you tonight, right? So Felix, why don't you go next and also share what is contactless healthcare for you and what have you seen as biggest change since COVID?
Yeah, so I'm building on what Sara said, because I think she said a lot of the key things there. But to be specific about what I've seen in the UK, I spent about 2 or 3 years working with the NHS, for example, and other clinical organisations, but the NHS obviously being a big one in the UK. And I was on the Digital Health London Accelerator, which is an accelerator program to help companies, startups with digital technologies to work with the NHS. And we spent probably 2 or 3 years trying to get projects going, and some did get going, but it was a really hard thing to do, very difficult. Then in March last year, I got a call from Partha Carr, who was previously the Assistant Director for Diabetes in the NHS. And within 2 weeks of talking to him, we'd kicked off the project. And within 2 weeks of the project starting, we were live with a project supporting people with diabetes to get help remotely from a collection of clinical advisors around the country, all connecting through a technology we developed. And so within a few weeks, we got the project live that had spent years talking about. And I think the COVID pandemic accelerated people's adoption of digital, but also accelerated their appetite to innovate and accept risk. And of course, the reality is the risk is very low, because if you think it through carefully, you can minimize almost all the big risks. And in fact, the key thing was just getting it done. And I've seen, that's one example, but that's happened again and again. So very quickly, lots of these projects that have been in the discussions for a long time have suddenly gone live. And the great thing is that we saw was that we ran the project through the first few months of the pandemic. And then as it all dropped, the cases dropped off over the summer, we paused the project, and then we restarted it again recently with the second and now third wave. So we were able to switch it on and switch it off very quickly. And I think what's happened there is that people seen that it's working. They then said, wow, let's do it again. So we're seeing that people are innovating, doing it, and then repeating it. So it's been a very, very amazing time to see how contactless healthcare has advanced.
Thank you, Felix. So basically, if I heard you well, what you saw is not so much the technology, but basically the speed and agility was the game changer. Where Sara, it was for you, it was about the potential of really doing things that way that we hadn't thought previously we could do. So Dan, from your perspective, what have you seen, and what is for you contactless healthcare?
Well, I think it's building on an example there from Felix is how the NHS reacted in COVID. I've got a few family members that work in healthcare as general practitioners, and they were waiting 3 years for their laptops. COVID happened, and they got them within 3 days. And Matt Hancock launched Teams within a week. So we just saw this huge transformation real quick. And what it meant for Pharma was we then suddenly had to think, how do we connect with these guys when the time is right? Because now, they're on Teams. And internally, we were already launching platforms and technology that might not have been Teams. And we were saying, but, we've got a solution, but that solution wasn't fit for purpose. It wasn't where our customers were playing at that time. We had to realign real quick. And I think a lot of Pharma did that. I think they probably did it quite well to ensure that we had the right basic technology that we could communicate with our customers when we wanted to, because we knew that's where our customers were. And, to wait 3 years for a simple laptop in primary care, and then to get it in 3 days just showed how quickly the NHS wanted to react. Now, if they can react that quickly, I think pharma companies can also react quite quickly when we put our minds to it.
Yeah. Well, what I take from you, Dan, is that maybe the crisis was never bad enough for us to change, and it takes a real crisis to change. What is interesting, if I summarize what you've said so far, and thank you for these great examples, is they are all digital engagements. Whether it was what Sara said, Felix, Dan, it's all about getting people connected, right? And that's quite interesting because previously, pre-COVID, if you went to seminars on digital was just another output channel from pharma to customers. It was nothing more than that. It was not a listening channel, and it was definitely not an engagement channel. Do you see that same thing that we've now entered into the true engagement era? Yep, I see you nodding. Good, then. Let's take it to the next challenge then. We hope soon, after the third, fourth, and fifth wave, COVID will be done. What do you see as the biggest challenge to contactless healthcare? Is it maybe, to Dan's point and Felix's point, the disappearance of the urge? Or Sara, is it going back to the old ways? Why don't we start with Felix this time?
Yeah, and it's a great one. The challenge is that it's maintaining this momentum, I think, and not drifting back to just doing what we used to do. But for me, there's a key part of this, which is that in certain circumstances, you must drift back. I mean, there's an awful lot of people who don't have safe or reliable access to the internet. They don't have a mobile phone that connects them individually. And so to have healthcare consultations on a shared laptop across the family, or across, maybe you're, in a public library or school, these kind of shared internet services aren't great for healthcare. And so we must remember that the going back to normal for some people will be very, very important. And I think the challenge will be making sure that these services work where they really do work, and understanding where they shouldn't be used. Because otherwise, the failures of healthcare for people who have poor internet access will be blamed on the technologies. And that could, of course, end up in people thinking that the technologies aren't working, that video meetings don't work with your GP, where actually they do work, but just not for certain types of people who still need those face-to-face meetings and other types of interaction engagement. So it's identifying where they work and doubling down on that, and understanding where they don't work, so that doesn't become a negative that then takes down the whole thing. Okay.
So adapting to individual needs is your main point there. Sara, what do you see as the biggest challenge post-COVID to people?
Felix brings up a really good point. There's a real danger here for it to just increase the inequalities we already see within the environment. And I've seen it in Canada, and I see it probably even more so here in the US. I think from my perspective, and so I do think we have to find solutions to bring people along and not leaving people behind as we move towards contactless healthcare. At the same time, I think that our biggest challenge is going to be the illusion that nothing has changed, and the strong pull that people will have to want to go back to, I think that is the biggest mistake that we can make, because on one hand, it means we're not taking opportunities that lay in front of us, where we actually have opened up a world of opportunities just by trying something new. And I think the second one is that really the world has moved on, and you can convince yourself to look at the world as it was before and to try to go back to it. But if we really pay attention to what's happening around us, I mean, so much has changed, not just in healthcare and the way that we're working and the way that we're learning, but the finance industry has been disrupted. We're looking at so many industries and tech and how it's moving forward. The entire world has really accelerated on everything digital and everything technology, and so the gap was already large before. If you try to go back to the old ways, I think the danger is you become completely disconnected. And in fact, I hope that this continues to accelerate and transform even more than we have in the past year. If you think back to where we thought we would be in 2020, back in the 80s, we thought in Back to the Future, we thought we'd have flying cars, and basically what we got is 280 characters on Twitter. And so I think that though a lot has of course evolved, and the internet has provoked a huge change, I don't think that we've actually embraced the internet, frankly, as much as we could have in so many different parts of our lives. So I hope that this will accelerate not just pharma, but the rest of the world and other industries as well, as we've seen a major transformation in the past year.
Okay, thank you. So the challenge here is resistance to change, basically. Maybe Dan, you want to add something? And if I may interrupt before that, Dan, do you think it's pharma or the doctors who are most conservative? I wear both hats, so I'm not offended.
I think it's a bit of both, which is a rubbish answer. But, you can probably argue that the transformation that the NHS has gone through recently has been pretty brave. I think the challenge, though, is how do they manage the expectations of patients? Felix made a good point about actual technological access, and suddenly that becomes something that carve society up to access to healthcare, and it's the privilege that can then get access. But how can the NHS, or how can any healthcare system manage the transformation back, which is patients will expect at some point that things are going to get back to normal, and they're not. Now, if we can make it really clear what the benefits have been, we might have a chance of managing that. So for example, in primary care, the forced reset has allowed doctors to catch up with their systems, with their admin, with headaches that they've been dealing with for years, and focus on the here and now. Arguably, COVID vaccination is a good indicator. They have done incredibly well at vaccinating the masses because I think they've had time to think. Now, that means we've got to cut out the stuff that used to take up a lot of time, such as people turning up every month with a hurty knee. Okay, I'm being a little bit flippant, but that used to chew up time in the system when actually they need to spend time on really complex issues. And I think for pharma, it's how do we adapt to that? Because, if we haven't had that level of contact or engagement in the last year, I think our customers are going to say to us, look, I've been okay for the last year and we haven't spoke that much. What are you going to offer me now? And then it's realigning their expectation to how we can then connect the value and go again to support their new environment. So I think that's something we're going to have to deal with on both sides. You're on mute.
Thank you so much. It's great, and it's a good insight, and it links and the challenge of incentives, right? As I said into my introduction previously, none of us really to go contactless, not internal in the company. Suddenly we had no choice, and having no choice is a pretty strong incentive. But what I hear from you now is that we between lines, you're all three saying we need the right incentives for people to embrace what's good and move forward with that. Does anybody want to say something about how could pharma play a role in creating an incentive, in helping the different stakeholders? And let's just fix three groups. We have the prescribers, so the doctors. Dan talked about the GPs. We have the patients. Sara, you were the first one to mention the patient. And then all three of us, all four of us, talked about pharma. So about these three, could you shed your light on incentives? Sara, you want to go?
Yeah, I'd love to just jump on what Dan was saying earlier around, there are definitely going to be some instances where healthcare providers need to see somebody in person, right? There's just some things that can't be done virtually. But I think it's really going to be about finding the right balance so that you actually create a better experience for everyone, where it's easier, it's seamless. There are plenty of consultations where people don't necessarily need to see their healthcare provider in person to be able to resolve that problem. Simple prescriptions, simple issues that a physician doesn't have to see up close, or where you can simply take a picture. And so I think it's really going to be about adapting it. And if you think about if the physician equivalent for us internally or with our customers as well, but if we're able to really focus the in-person time that we have so that you actually augment that experience so it's even better and it's really a quality experience, and there's a reason why you need to leave your house, and there's a reason why you need to travel to see that person live, then you can also augment that experience, but you can also make the other experience of having remote contacts being even more appreciated, because frankly, as personally, if we don't have to travel places, we've done so much through virtual, why would I have to spend 2 hours out of my day to see my doctor for 10 minutes? Or even as a customer, do I really have to make time in my day to see the rep in the middle of when I'm seeing all my people, my patients face to face? Can I, sort of optimize and have a clinic where I really the interactions and things that need to be done in person, and then have other times where it's a virtual call, which would work as well as doing it from the office. So I think there's a real opportunity here to sort of make it much more seamless, much easier, and actually even from a virtual world, rather than trying to do the same interactions we've done in person by Zoom or whatever technology we're using, how do we enhance that experience so it actually becomes a more, we're not trying to just do the same thing online, but we're actually trying to make it a much better experience and something that would, provide some kind of digital enhancement. So you make the in-person meetings better, and you make the online experiences better as well. And I think that just enhances each touch point that we have, and it also probably allows us more touch points because you're not spending as much time in those in person and all the things you do in between to make those in-person meetings happen.
Okay, thank you very much. Dan, you want to add something to that, or Felix?
Yeah, I think Sara makes some excellent points. It's how do we then connect the dots? So how do we then really communicate the benefit of each of those interactions, whether it's a healthcare to patient or whether it's pharma to customer? And I think if we can really be, and we've got to change the way we articulate, I think, because we've got to be really clear what that new setting is different and how the value is going to be understood. Because, it's only a matter of time when society opens that companies are going to say, right, guys, you need to do X amount of remote, X amount of face-to-face, because we knew face-to-face was what happened before. So that must have worked. So we've got to go back there somehow.
Oh, yeah.
Maybe we don't. But it's then saying to the customer, well, in those settings, this is what you're going to get. And I think it's okay for us to say, we don't really know everything that you need to know right now, but why don't we try and work this together? And I think that's a huge opportunity, is to take some time to really understand what the new environment is, what are the current challenges, and how can pharma support appropriately. I think probably now we're delivering initiatives that were built last year that we're now retrofitting into the environment because, hey, look, it was in the brand plan, if last year, let's deliver on it, when actually we need to reset and co-create and listen to our customers. That's going to take time, it's going to take investment, and we might need to be brave in a few places, but that's something we should do so that when we go forward, we're going forward with a higher level of confidence that our new initiatives are going to work.
Yeah. Felix, I'm going to ask you to comment, but also do it while addressing the question we got on the chat from Arun. Does any of the panel members think that the interactions between the doctor and the patient will completely go virtual, right? If so, when? If not, why not? Maybe you can blend that into your comment. Is that possible?
Yeah, that's fine. Well, why don't I just answer that quickly, which is, I think, definitely not. There's certain things you must do in person, examinations. You must examine people. That's a large part of making a diagnosis. And investigations, you can't take blood from somebody virtually, even if somebody needs to do it in person. And so there will always be contact healthcare, and it's key. And if somebody's very sick, they're going to end up in a hospital and see doctors directly. But I think that there's some things that work very well remotely, and it's about identifying which ones work, remotely, contactless, and not moving everything remote. And making sure, as we talked about before, that everybody gets access who can. And to follow up on Dan's comment, I think I'm seeing the industry doing really well, the pharmaceutical industry doing really well, because I've seen, we're specialist digital agencies, so we obviously get the people who've made that change. So we're seeing a lot of people who've been very agile, who've changed their plans immediately. From April onwards, our work has been growing and growing and growing because people are doing digital because they know they need to. And I'm seeing them doing it very well. They're producing fantastic online content, really being responsive to these virtual meetings and things where, virtual congresses and stuff, where they're being digital and being out there with virtual booths and virtual presence. For example, we ran a digital advisory board last year where within 2 weeks in April, we set up a digital advisory board for a company who's developing a treatment for COVID-19 to get advice from an international panel of doctors. So they're collaborating on an international level, listening to their customers, listening to the real experts to get advice on how they're developing that medicine. And they switched that on immediately. They didn't wait for some kind of face-to-face advisory board in the future. They went straight to digital using text-based asynchronous things. And there's examples where I'm seeing all the time customers who are being reactive, being innovative, who've ripped up the old brand plan and chucked it in the bin and moved on into the new world. And the thing that's really nice is I think it's really valuable. People are moving, they're getting rid of the stuff that wasn't working very well for either party and moving towards the stuff that really is valuable. They're resetting, really thinking about stuff. I'm seeing it as a really good thing, and I'm just hopeful that this doesn't disappear once we go back to face-to-face and everybody just kind of quit digital. But I'd be very surprised because people have really seen the value in it now. You know, they've done it once because they had to, and they've realized it works, and now they're repeating it. And that repetition is making me think it's here to stay.
Okay. So if I see all the fierce nodding going on, is it fair to summarize, because we're coming a little bit at the end, that while contactless healthcare is not the next normal, as in exclusively, we all seem to agree that it's going to be a fundamental part of the next normal. It's going to be a part of it, right? In with all the comments that you said about that. Would you care to make one final recommendation to the audience as to practically what start doing as soon as they hang up from our call here? And why don't we start with Dan, then we go to Felix, and we'll end with Sara.
Okay, one final comment, and it's I guess leaping in a lot of comments over the last day and a half is just the accessibility. You know, we've got to make whatever we do, just make it really easy to get hold of, to digest, and to understand, whether that's for patients, whether that's for customers. Just make it really easy. You know that it's click and access, not click and connect. And for me, it's got to be one step away, and we can keep working towards that.
So simplicity. Felix.
Sure.
For me, it's understanding where digital works, where in-person things work, and they're different. And you need to use digital in the right way, and then it's very successful. And use face-to-face in the right way, and then that can contribute. You know, they can be synergistic and really support each other, and you end up with a much better situation than just using one or the other.
Hybrid. Sara.
Yeah, I think the only thing I would add is really looking at, how do we use digital to really enhance and increase our touch points? And what can we learn from other industries in terms of how we can disrupt ourselves by getting that constant feedback through digital means and through those different types of interactions? So if you take Netflix as an example, Amazon as an example, those are companies that have disrupted themselves based on the constant feedback that they're getting. And, if you take the example of Netflix, they were able to go from sort of just a content provider to actually being able to develop content on their own because of all the insight they were able to gain through the way people were interacting with the content they were providing. And so I think from my perspective, it's really about how do we really challenge ourselves and use the feedback that we can get through digital means to really make a great experience and have these just a different level of touch points and interactions with our customers that will complement the face-to-face opportunities we have.
That is fantastic. You have given the summary, because what we're looking for contactless healthcare is a simple and hybrid model with ongoing learning through feedback. That's the three of you together. And I think that nobody knows it. Thank you so much. Thank you, audience, and over to the next session. Thank you, panelists. Sara, Dan, Felix. Bye-bye.
Thanks very much.
Bye.
See you soon. Bye-bye.